Javid Abdelmoneim. He is in the Gaza medical team leader for Doctors Without Borders. He's with us from Khan Younis in Gaza. Many thanks for joining the program. The last week, as we've been hearing, has been one of the deadliest in Gaza since the war began. Nearly 500 people killed in the last 10 days. The pressure on medical facilities must be immense. You've been treating patients at Nasser Hospital in Khan Younis. Can you tell us what you've seen?
Malene, thank you for having me. In the last 3-4 days since Saturday, we've had 2 mass casualties at the Nasser Medical Complex in the emergency room. MSF, we run a 64-bed trauma unit with 2 operating theatres. So, of course, we're invested in helping to manage the emergency room with the mass casualty events. The event on Saturday exceeded any capacity that any health system in the best of the world could manage, and that's not talking about the fact that we are on our knees. We were dripping in blood at the end of it. The first case I saw was a 3-year-old girl with her thigh peeled off her bone. The second case I saw was a woman covered in dust. She looked at me, she was breathing. It meant that she's globally okay, but I took down the dressing on her belly, and a piece of abdomen, a piece of bowel was out. And then suddenly a rush of healthcare workers, fully dressed first aid responders in their uniform, all injured. It was so shocking to see healthcare workers injured in this way. And then I looked across at my nurse, and they were helping manage the airway of a boy that looked about 13 or 14. And she looked at me, and in a mass casualty, if you have to manage the airway, you have to call that person dead. He was a boy. None of us had the heart to call him dead. And then the next one came in, and the next one came in, and there were no beds, and you're kneeling on the floor, and you can feel your knee is wet with blood. And you have to quickly decide who's more urgent and who's not. This man looks like he has a brain injury. He has to be left for dead. This woman has her knee almost blown off. Take her straight to operating theatres. Very quickly, all 8 operating theatres in Nasser Medical Complex were full. All the surgeons that were available were operating. I still had 2 critical cases in the resuscitation room, still surrounded by hundreds of patients in the yellow and green zone. We had to try and send these patients somewhere. One we kept with us waiting to go to the OT. The other we sent to one of the local field hospitals, even though he was unstable and shouldn't be moved. I know that both those patients died. This is in the context of looking up, can I just say, looking up in the middle of managing all these patients. And I saw my anaesthetist colleague there, and I said, why are you in here? What's happened? And he said, I've just found out my house got destroyed and my family's in here somewhere. And he subsequently found out that his nephew was killed and his 2 daughters were injured, but thankfully alive. And this was a strike in the so-called humanitarian zone on Saturday. It just goes to show that nowhere is safe. And before we even had a chance just to absorb what had happened, the next morning we got a call from my nursing colleague in our clinic in Gaza City saying that his house had been destroyed and 2 of his 3 children were killed and his remaining child and wife were injured. It does carry on, sorry.
Clearly you are dealing with non-stop injuries from the non-stop targeting of the Israeli bombing and so on, but are you also treating disease, malnutrition? How many cases of those are you seeing? Because increasingly we are hearing about the problems related to sanitation and so on are also causing a lot of deaths.
There are severe problems to do with sanitation, water and sanitation and hygiene, diseases and illnesses related to poor conditions for hygiene feature high, the top 3 or 4 conditions out of 5 in the primary healthcare centres that we run as MSF throughout the middle area and Khan Younis have skin infections, diarrheal infections, eye infections, and scabies infestation. And those are classic water and sanitation hygiene related illnesses. So that tells you that the response, the facilities, the provision of soap, clean water, latrines, are simply inadequate in this small area. With regards to malnutrition, we are running a severe acute malnutrition therapeutic feeding center in Nasser. It is permanently full. It is only of 4 beds. We haven't seen what we would classify as critical and emergency thresholds of malnutrition, but the more vulnerable children, children with disabilities and other chronic conditions, are the children that we're seeing come in with severe acute malnutrition.
And Dr. Nasser Hospital was once the largest working hospital in southern Gaza. It's not been functional as a proper hospital since February of this year. Given that, how challenging is it to treat patients? I mean, what are the biggest difficulties you are facing? Is it the lack of medicines? Is it the lack of equipment? Is it the lack of electricity?
Malene, it's all of the above. So given that nowhere is safe, there are mass casualties seriously. We had another one yesterday in the so-called humanitarian zone. We're operating in a context where fuel is not enough, so that, for example, when Nasser has to ration its fuel and switch to a smaller generator, we don't get water pumped to the inpatient department. The 64 beds that we have, the operating theatres, one Saturday last week, we had no water across the whole department until 2 p.m. It means that they ration the air conditioning, and that sounds like it's a frivolity, but of course it's not. When you have surgeons in this heat sweating into what should be a sterile field, you have to cancel theatres so that they can cool down and prevent infection. Our supplies have been minimally low. We haven't had the supplies that we need. So I've had to reduce the frequency of dressings changes for our burns patients. Rather than doing every 2 or 3 days, since June, we've been doing it every 3 or 4 days. Absolutely essential medications for things like sedation, fentanyl. There's an internal market bartering that we have every day. My pharmacy manager with other NGOs, I was within a week of rupturing fentanyl. We need it for sedation. We need it for anesthesia. We had an excess of sutures. I did a swap with another NGO. We're right now having surgical gowns tailored because we don't have surgical gowns. We ruptured in examination gloves. How can you examine patients without gloves on? So this is just to show that we don't have enough supplies to do the work that we need to do. Add to that mass casualties, add to that fuel and cutting of water and so forth. It really need to get out there the idea that the health system here is on its knees. We have in our pediatric department in Nasser 2 to 3 children per bed. There aren't enough mattresses for the beds. There aren't enough beds for the numbers of patients. The system is beyond what it should be doing, and it is detrimenting the health of patients.
Thank you so much for your time. And given the challenges you are facing, thanks for talking to us on Al Jazeera. Dr. Javid Abdelmoneim, the Gaza medical team for Doctors Without Borders. Thank you.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.